Welcome. Today we're going to talk about schizophrenia. Schizophrenia is a chronic brain disorder that affects how people think, how they feel, and how they perceive. Its hallmark is psychosis, and psychosis is characterized by hallucinations. Hallucination is a perception in absence of stimuli, and this happens in all the five senses. These individuals see things no one else can see. They hear voices of people they can't see. They feel things crawling on their skins, but they can't see them. They smell things no one else can smell. They taste things no one else can smell. The other one is delusions, which are false fixed beliefs that only make sense to the patient, and they go against the patient's economic, social thought process. The other one is disorganized speech. This individual speaks in an uncoordinated way and things that don't connect. They have disorganized behaviors. They do things that don't make sense. These symptoms usually have gone on for at least 6 months. What are the causes or the risk factors? Genetics is one of them. Like all the other mental disorders, genes play a very, very big role in schizophrenia, and it is passed on from generations through the DNA. They've also found brain anatomic abnormalities in these individuals, but the most significant thing is the neurotransmitter abnormalities, where these individuals have an excess production of dopamine. Perinatal factors like infections in pregnancies are as risk factors. So is the use of cannabis and marijuana. Individuals who have used cannabis or marijuana tend to present with psychotic symptoms faster than any other individual that is not using. How do we investigate it? There are no blood tests to confirm the diagnosis, but we'll carry out investigation to rule out other diseases. We do a complete blood count to rule out infections. We do a liver function test, a renal function test, urine testing for drugs, and HIV test. How do you manage schizophrenia? The mainstay is the use of antipsychotics. They work by reducing the excessive production of this neurotransmitter, the dopamine, in the brain. And of course, psychosocial interventions come in handy. They're very important. Things like cognitive remediation, and this is done in individuals whose psychotic symptoms have been stabilized. Vocational rehabilitation is very, very important. Remember, this is a chronic illness that is long life, and it's actually a lifetime disorder. So quite a number of patients tend to be admitted in hospital for long. So we want to teach them skills they can use once they go out of the hospital. Family intervention is also very important. We need to psychoeducate the family, teach them about the disorder and how to deal with these individuals. In the next episode, we shall talk about drug abuse and addiction. Thank you for watching and prioritizing your mental health.